Accentuated S1 is the word which I missed in the previous video. Okay, let's start with the clinical manifestations of VSD. The patients become symptomatic around 6 to 10 weeks of age. At this time, the CHF may develop 6 to 10 weeks. Yeah. In ASD, in contrast, only in the fourth decade of life complications occur, but like VSD is a very big water. So, 6 to 10 weeks of age itself, the patient becomes symptomatic. At this time, the congenital heart failure may develop. Frequent symptoms, palpitation, dyspnea on exertion, and chest infections are also common. Symptoms of congestive heart failure improve and the cyanosis develops once the pulmonary vascular resistance increases above the systemic vascular resistance, which is Eisenmenger physiology. Signs: there is a hyperkinetic precordium with a thrill at the left sternal border, pansystolic murmur at the left sternal border. S1 and S2 are masked by the pansystolic murmur. Maximum intensity of murmur is at third, fourth, and fifth left intercostal spaces. S2 can be made out at the pulmonary area, which is the upper left sternal border, where it is not masked by the pansystolic murmur. S2 is widely split with accentuation of P2. S3 may be audible at the apex. A delayed diastolic murmur is heard in the mitral area. So like PSM, pansystolic murmur, and DDM, delayed diastolic murmur, are characteristic of VSD. PSM and DDM for VSD. Pulmonary systolic ejection murmur is also heard in the pulmonary area. Cause and complications. 70 to 80% of all the VSDs become small in size or disappear spontaneously, that is spontaneous closure of VSD. Large VSD may have some complications. The complications could be pulmonary hypertension, congestive heart failure, which is like common for both ASD and VSD. The specific complication which is not seen in ASD and seen in VSD is infective endocarditis, and then aortic regurgitation as well. VSD is the most common congenital heart disease complicated by infective endocarditis. Chest X-ray in VSD increased pulmonary vasculature, which is pulmonary plethora, left atrial enlargement, cardiomegaly if the defect is large, normal to small aorta, normal size of the heart if the defect is small. The X-ray shows pulmonary plethora, left heart and left atrial enlargement, cardiomegaly, normal or small aorta, normal size heart if the defect is small. So if the defect is large, the heart is large. If the defect is small, the heart is normal size. The aorta is small. The left atrium is usually enlarged and there is pulmonary plethora. Thanks.